climate progress and setbacks at the state level. Joel Charles is going to be the moderator. Mark Mitchell from Connecticut and Bob Kitchen from Virginia will be the speakers. And there's been a lot of work done to try to make progress in the area of transportation policy, as transportation is now the largest single source of greenhouse gases from the US into the atmosphere. So I think you'll find this policy session very interesting. We're actually moving into the part of the meeting now where we're going to be focusing much more heavily on policy. So please stick with us, and I think we can go to Joel Charles.
Thanks, Dr. Sarfati. Yeah, and thanks everybody for being here. It's been a great session so far today. As the saying goes, the states are the laboratories of democracy. And I think you really need to look to the states to see sort of the different options for policies on addressing climate change and health. And there's a lot of rich information and lessons there that can be learned. And in some of those policy struggles, our state CCA groups have been very actively involved. And so we thought we'd highlight today a couple states, Virginia and Connecticut, and some policy opportunities that came up, and some reasons for success in one case and some reasons for some barriers in another case and needing to go back to the drawing board. So first we're going to start with Virginia. Dr. Robert Kitchen is a board certified family physician who retired in April of 2018 after 39 years of practice. He most recently practiced with the Mid-Atlantic Permanente Medical Group, providing care for members of the Kaiser Permanente in Northern Virginia. During his 24 years with MAPMG, he cared for a panel of patients and also held administrative and leadership positions. Prior to this practice, he served 20 years in the Air Force with both stateside and overseas assignments, with the last 6 years being on the faculty of the family practice residency at Andrews Air Force Base. Bob received his MD degree from Tulane University School of Medicine and his BS from the U.S. Air Force Academy. With that, we'll go ahead and start. Take it away.
Thank you, Joel. Yeah, I certainly appreciate the opportunity to speak today representing Virginia Clinicians for Climate Action. And Colin, next slide. VCCA is a state affiliate of the consortium and was founded in 2017 by Dr. Samantha Adut, a pediatrician in Alexandria. And we currently have over 450 members across the Commonwealth of Virginia. And one of our major activities is advocacy at both the national and the state level. And this picture is from a few years ago when we advocated or went to Capitol Hill during one of the consortium's annual advocacy days. Next slide. And our main activity for advocacy is when we have our annual advocacy day for Virginia, going to Richmond to meet with our delegates and our senators. And in 2018 and 2019, we were able to go in person. The last 2 years have been virtual. But during these visits, we talk with our legislators about the importance of addressing climate change and the impact on the health of Virginians, and actually identify specific bills that we think will address this and ask them to support those bills. Next slide. An area that we identify as a challenge as well as an opportunity in Virginia is that of the impact of transportation and its effect on climate change and the adverse impact on people's health. And Virginia is quite high in terms of the amount of CO2 pollution that comes from transportation at 45%, when the national average is 28%. There's also recognized there's a disproportionate health impact of transportation pollution on disadvantaged communities. Another aspect is unhealthy air quality in diesel school buses. And another point is that we have a low number of electric vehicle new car sales in Virginia when you compare it to several other states, such as California, which is about 9%, the district's 5.5%, Oregon and Washington are about 4.5%. But these states are all part of what's called the Section 177 of the Clean Air Act, and I'll explain that more later. Next slide. So if we could get decarbonization policies implemented in Virginia, it would not only lower greenhouse gas emissions, but also reduce air pollutants, especially particulate matter 2.5. And PM 2.5 has been recognized as particularly injurious to health, and it's associated with increases in premature mortality, as well as cardiovascular and respiratory morbidity. Next slide. So recognizing this impact of PM 2.5, VCCA, in partnership with the Energy Foundation, commissioned a report on the health burden of ambient PM 2.5 in Virginia. And it also analyzed potential health benefits of clean car policies by 2035. If you're interested in this report, you can go to the VCCA website at virginiaclinicians.org, and there are links which will take you to the text of our transportation report. Next slide. Some of the findings from our report initially looked at all transportation-related PM 2.5, recognizing that what's impacting Virginia isn't just produced in Virginia, but in surrounding states. And so when you looked at the health impact of all vehicular PM 2.5, in Virginia, it's responsible for 190 excess deaths, 150 non-fatal heart attacks, 450 new asthma cases, and 21,000 lost workdays. And the annual health associated cost of this is $1.6 billion. The map on the right-hand side shows PM 2.5 levels across the Commonwealth, with the darker counties being the ones with the highest numbers. You can see that Northern Virginia, Richmond, Norfolk, and somewhat along the North Carolina border have the higher levels. Next slide. And then the report went further and analyzed just the PM 2.5 from Virginia-specific transportation, i.e., the transportation we would be able to have an impact on through legislation. And when you break it down for PM 2.5 from Virginia, that's responsible for 92 excess deaths, 71 non-fatal heart attacks. You see the other numbers, and the cost is $750 million annually. And the map looks pretty similar to what we see from all transportation-based 2.5. Next slide. There's also an impact on children. Again, back to Virginia-specific PM 2.5, it can be identified as connected to 2,600 child asthma attacks, over 200 new cases of asthma, and over 3,000 cases of child bronchiolitis and respiratory symptoms. Next slide. And there's an environmental justice impact in terms of how it affects disadvantaged communities. Now, these slides basically show the impact of pollution in general across the Commonwealth. And again, these are the counties, and they're identified by their social vulnerability index. And you can see on the left-hand side how the CDC defines social vulnerability from socioeconomic status, minority status, et cetera. And it's found